Warning, this video may trigger anger and frustration, but please stay until the end and I'll turn that around for you. Today, we're talking about Henrietta Lacks, and her story is one of the most important in clinical research history in the United States. In 1951, Henrietta Lacks was a 31-year-old mother of 5. She went to Johns Hopkins Hospital because she was experiencing severe abdominal pain and abnormal bleeding. She was then diagnosed with cervical cancer. As part of her treatment, her doctors collected samples of her cervical tissue, and she was not told at that time that it would be used for research. She did not give consent. Here's something we need to understand. As part of the diagnosis process, sometimes some physicians would collect both healthy tissue and cancerous tissue. Usually, the healthy human cells will divide a limited number of times before they die off. And then the cancer cells usually replicate a few times before they die off. In Henrietta's case, her cells divided unusually aggressively, and they kept dividing in the lab and did not die. Those cells were kept, and they became known as the HeLa cells. And they were used to advance medicine and used in other areas such as to develop vaccines, in cancer research, to study viruses, including HIV. In fact, those cells were distributed worldwide. If you'd like to read more about her story, check out the link in the comment section about the biography of Henrietta in the show notes. Also note that in 1951, there was no informed consent laws as we have today. Her tissue was taken without her permission. Her identity was not protected. Unlike other stakeholders, her family did not even benefit from the research that changed the world. For many in the African American community, this story deepened the distrust in medicine. Now, here's the part that shifts the narrative. Because of stories like hers and the Tuskegee trial, informed consent is now mandatory. Institutional review boards must oversee research, and participants must be told about the risks, the benefits, and if there are any alternatives. Also, privacy protections must exist. Also, in 2013, the NIH reached an agreement with the Lacks family requiring permission for access to the HeLa genome or cells. And then in 2023, a settlement was reached between her family and a biotech company that had profited from her cells. Finally, reform and accountability came to the Lacks family. Henrietta Lacks did not consent, but her story reshaped research ethics. Her cells advanced science, and her experience advanced accountability. We honor her by telling the full story. Today, you have rights that she didn't have. You have the right to ask questions. You have the right to say no. You have the right to understand both the risks and benefits, and the right to informed consent in any research trial. And this is where our channel comes in. Here on Research Tips, we stand on the work of the Black pioneers who spent their careers progressing medicine through clinical research. And we must continue the work by participating when it makes sense. Our community deserves both progress and protection.